Every family's worst fear is facing a child's serious or terminal illness. But in those unimaginable moments, Capital Caring Health is there, offering comfort, compassion, and hope through their leading children's hospice and palliative care programs. And here to tell us about the comfort they provide from Capital Caring Health is Steve Cohn. Steve, welcome back.
Thank you.
I'm glad to talk about this as well. Wow, one of the nation's largest top children's hospice. How did that come to be?
Well, actually, we talked earlier about how Capital Caring started way back in 1977. We were the first hospice group in the nation to provide care for terminally ill children as well.
Oh, wow.
And we were the first hospice organization to create a dedicated pediatric team, which is very important to provide the right kind of care for the child and the whole family. And there are just a handful of hospice groups out of the 6,500 that have a dedicated team. We were the first. Others have followed our lead, we're happy to say. And it's just a wonderful thing to be able to help these children. Now, hospice care for children is very different than it is for adults.
How so?
We call it concurrent care. So with adults, we're trying to make them pain-free and comfortable. To be eligible for hospice care, they no longer are getting curative treatments. With children, there was a law passed that we helped get passed in 2010 that says we are also trying to cure the child as well. So with children, we're doing curative methods as well as trying to keep them pain-free and comfortable.
Sure. And I understand that over 50% of the child care is in minority populations. Is that true?
At
year
the moment,
after year?
about 60% of our kids are from disadvantaged neighborhoods. And that tends to be a trend that we've seen over the last few years. And a lot of these kids and their families have little to no insurance. Sometimes Medicaid is there for them, but sometimes it's not. And also a lot of the kind of extras which we think are very important are not covered by insurance. And so we rely upon philanthropy for things like music therapy, art therapy. We do virtual reality now with kids, so they can experience whatever comes to mind that they want to see. A planet, a concert, a beach that they went to when they were younger. Whatever comes to mind. We find adults are kind of put off by that, but the kids love it.
Kids love it, yeah.
And we also provide a lot of support for siblings, if there are siblings.
I was going to ask, how do you provide comfort and support to the families?
Well, it's just like for adults. It's a family-centric service. And especially with kids, it's important to have all that support for the siblings and the family, because otherwise, going it alone, think of the stress they would have.
Of course, yeah.
So.
Yeah. How do you talk to parents if they're feeling unsure or afraid about their child entering into hospice?
Well, as I mentioned earlier, we find that most families want to enroll their children as soon as they find out their child is has a terminal condition, and they discover that hospice care for children is also providing curative treatment. They want to get the child out of the hospital, as the hospital does, and back home. And the vast majority of the time, we're caring for them in their home. Sometimes we take a child and put them in our inpatient center, but most of the time we don't have to do that, and we prefer to provide the care at home.
All right, Steve, thank you so much.
Yeah.
Thank you. To learn more about their pediatric care, head to capitalcaring.org.